My name is Abdullah Saleh, and I'm the Chief Executive Director and co-founder of Innovative Canadians for Change, and I'm a general surgery resident at the University of Alberta. So I was asked to participate in the GYA because of some of the work that I've done in Kenya, particularly the Kenya Ceramic Project, where we have developed technology to purify water and have introduced it into Kenya, and I've actually ended up building a factory that is now employing local capacity as well as providing ceramic water filters to the community affordably and sustainably.
Fantastic. Can you tell me what your original expectations or hopes were for this project when you first started out?
Initially, I thought we would develop the technology in a lab and here at the U of A, and then go to Kenya and just find a lot of potters and just disseminate the idea to them and let them sort of grow from there. And it was solely supposed to be a horizontal transmission of the technology. So go there after we've worked out some of the kinks and share it with people who would understand, and then have them sort of build industry and have them make the social impact.
And what has happened in reality to this point?
Well, that first summer we went, we landed in Kenya. We did an extensive needs assessment from the east coast to the west side of the country, and we realized that there was a huge need for it, and people wanted the filters, and realized that there was definitely a market and a niche for it. But the technology in Kenya, at least in the rural areas, was not able to make these filters. So the kilns, particularly that they use in rural Kenya, don't reach the high enough temperature to burn off the organic materials to make our porous filters. So we were a little bit at a standstill for about a week and a half, because we knew in the backs of our heads that we would need to build a kiln and potentially build a factory, but we didn't want to believe that, because we were like, we have no business making a factory in Kenya, of all things, as well as go to medical school.
Did you face any other challenges along the way?
I think there was a lot of challenges both in North America and in Africa. A lot of the challenges in North America was that as learners, maybe you should be more cautious and less cavalier about the way you do development attempts. And so there was a lot of opposition, especially when introducing a new technology, that we weren't just fulfilling our desires and our sort of selfish drive to be cavalier about development, go into a country and just give this solution as if it was the best thing to happen since sliced bread. And we would try to say that really that's not our intention. We want to share this idea with them and see how they uptake it after we talk to the community. But it was hard to convey that message, because I think when you're developing a technology, it's in a way it's sexy development, and people want to hear about it, and they want to hear your personal story and the challenges you face. So it ends up being a very egocentric presentation about these are the challenges we face, and this is what we did, and a lot of I and a lot of we, rather than a lot of them and a lot of their needs and their considerations for taking on any idea or any project. On the ground, a lot of the challenges we faced was when we started communicating with organizations to see where would we base our initial pilot phase. There was two types of responses. One that said, "Oh yeah, please come and bring all the money you have, and we'll make this happen." And little like alarm bells go off in the back of your head. You're like, this might be a bit more corrupt than good. Whereas the other, I think, overwhelming majority was that they didn't think we could do it, and that when we pitched an idea that these are going to be it's a technology that has been developed elsewhere around the world but hasn't reached mainstream, and we're trying to make it mainstream in your country, and will provide clean water affordably, sustainably, at a fraction of the cost of alternatives. They thought this was a scam. and they thought that, one, it was just a foolish notion that we had, but two, that it potentially we were scam artists, or we wanted something from them. And so there was a little bit of mistrust initially.
Okay. What in the world would incredibly crazy busy decide that they should do something like this?
That's a good question. I think med school tends to attract a lot of people who are driven and who are just, maybe that's an overgeneralization, but are not happy with status quo and want to make an impact. At least that's a segment of the medical student population. And they come into medical school with this notion that we're helping people. And then you see the healthcare system and you see its limitations, and that you do impact people, but your impact is fairly small. And that we thought we could do better. We could do something that affected public health, and in a way made why we needed to be trained so extensively a little bit obsolete, because we call it healthcare, but really it's disease care. And we wanted to promote health, so we started working on models to prevent disease, because that's the biggest burden, and not so much the therapeutics of it or how to combat it once it happened, but how to prevent it at the source and on the ground. And so I think we were just foolish enough and idealistic enough to take on a project like that in medical school. And I think it was just the right time, because we had that vote of confidence that we were going to be doctors, but not the reality that we were going to be doctors.
All right. Now that this has blown into something that you just did not expect, like you said, UNICEF called or emailed the other day, what are your goals for the project? Where do you see it going, this little project?
I think the goal after the first summer, when we realized what we needed to do, and it's true to this day, so that's been 4 years of this work, is to create a program, not a project, and I know the name is a bit misleading, but to create a program that outlines from the technology to the end user, fleshed out with the education, marketing, and sustainability, as well as a research component where future students and academia can come in to make these projects better and understand them better and have lessons learned. So this project almost acts as a microcosm of best practices for development in this type in this type of environment or in this part of the world. And then we want to, in a way, challenge the UN and challenge governments and other organizations to scale it and to replicate it, but to not make the mistakes that, you know, it's a one solution for fits all sort of model, but that it's a combination of oversight as well as grassroots that will be the solution, I think, to a lot of development issues. That community involvement, but also beyond just the women groups and such, that you can create industries, but just remember that this industry is going to exist in the community.
Finally, I just want to ask, what other youth, you're here speaking to youth, what can they do to make a difference, to make a positive change? In an environment like this, we hear a lot of, like, you can do it, you can make a change one person, but outside of this environment, we hear, like, well, I'm one person.
I think the biggest message that I'd like to send out there is that one person can make a difference, that in order to do so, you have to be willing to take criticism and to show your ideas openly so that you can benefit from the criticism, but don't let the criticism prevent you from doing that project or doing that performing that idea, because that will be the biggest shame if you have an idea but you brought it in front of a panel of experts who tell you that these are the flaws with your ideas, and you accept these flaws, but you don't correct why your idea is flawed, and then give up on it. I think the biggest thing is show your ideas, show your work plan to as many people as you can, get their feedback, but don't forget that this idea could actually be implemented. It's not just an academic model, because academics tend to a little bit rain on our parade when it comes to development, but they have a lot of tools that could be utilized, but don't let it dismay you and to prevent you from doing these life-changing or world-changing projects.
Thank you very much.